Case number 5. A patient with sickle cell disease presents to the emergency room with sudden pallor, fatigue, and a dramatic drop in hemoglobin levels. Which complication of sickle cell disease is most likely responsible? A. Aplastic crisis. B. Hemolytic crisis. C. Iron deficiency anemia. 3. Splenic sequestration crisis. Correct answer A. An aplastic crisis in a patient with sickle cell disease is typically characterized by an abrupt halt in red blood cell production, leading to a rapid and severe drop in hemoglobin levels. This crisis is often precipitated by infection with parvovirus B19, which targets and destroys red cell precursors in the bone marrow. The result is a sudden onset of severe anemia, manifesting as pallor and fatigue. In contrast, a hemolytic crisis involves the destruction of red blood cells, but not a cessation of their production, while splenic sequestration crisis involves pooling of blood in the spleen, not necessarily affecting bone marrow function. Iron deficiency anemia is less likely given the patient's underlying sickle cell disease and the acute nature of the presentation.